Welcome to Kaiser University's Multidisciplinary Center. We are proud to present KUMDC's School Psychological Services by Michelle Tano. Michelle.
Thank you for introducing me, Caesar. As the school psychologist for the KUMDC team, I want to talk to you all today about the psychological services that we are able to provide the districts that we are serving and trying to be a part of. The main topics that the team can provide are presented here. So we have things that we're going to discuss today, such as consultation, prevention, evaluation, intervention, review and planning, the education and training, some of the limitations, and the referral process summary. So the first thing I want to talk about is how the team can really assist with consultation for the teaching staff, even sometimes with the parents and the administrative other members like the paraprofessionals. So the consultation process would be, of course, based on the school requesting some assistance with some of the realms a school psychologist covers. So it might be concerns about student behavior, some academic performance, maybe some of the emotional well-being or behavior in the classroom and how they're relating with their peers. So really anything that has caused concern would be a referral concern and a topic for identifying what factors are contributing and being able to assess for further strategies or interventions that can be put into place to help the student kind of either get out of the danger zone and the at-risk position they're in, or perhaps have a tweak to an already existing intervention that just isn't working right now. So with that said, after the consultation, we would identify what the problem behaviors are, perhaps brainstorm some strategies and interventions to try to solve some of the issues, and that would basically lead to developing an action plan. And so within this conversation or physical piece of guidance or the implementation of new intervention ideas or just new tweaks to an existing intervention or even classroom management strategies or placement location of where the student is, there's so much that can be done and it just has to be organized into an action plan. This also is to provide the teaching staff with better ways to collect data for themselves, progress monitor, and work within the RTI or MTSS system that they've already been working with in the schools. A lot of times this can become overwhelming, and just that one-on-one consultation can help clarify and create better plans for the teacher and student that is of the referral concern. Prevention is another piece and a very important way that a school psychologist can assist the school and the team of the, perhaps grades that are more at risk. For example, the younger ages like kindergarten or first grade. There's early intervention programs to help identify what children are at risk for perhaps some learning issues or developmental delays. Some behaviors might start appearing in those ages that could lead to further assessment of perhaps autism or different types of ways that we can begin to, before things become a problem, really implement the screening that would be needed to kind of catch children who might have fallen through the cracks otherwise. Post-pandemic, I feel that social emotional learning programs are key as far as prevention would be for the early years, but also in transition times like middle school, where some of these skills, for example, self-regulation, how to handle conflict resolution, that can be presented as a whole class or a whole grade. And that could be something that a school psychologist helps develop with the teachers of that grade or the vice principal of the school, however they want to implement it, whether it's school-wide, just classroom-wide, or just individual. These are programs that can really be helpful to prevent problems before they escalate. Perhaps there's a whole grade that is having a lot of bullying. That would be a perfect referral for a whole class intervention that myself or someone on the team can help implement with the teacher. And speaking to that, to help create a positive and safe classroom environment. Many times, it may not be specifically a cognitive or behavioral problem with a student, or it may not even be the teacher having struggles with classroom management. It could just be that the placement of the seats or the way that the schedule has transitioning is not creating a successful environment for learning and calm interactions. So a lot of times just being able to observe the classroom and give some tips or ideas and collaborate with the teacher on just how to create the most effective and positive learning environment. The bread and butter of school psychology is definitely our assessments and evaluations. However, I wanted to discuss those first two pieces first because really that is necessary before we get to start evaluating individual student for a specific concern. Some of the things that would have to be done prior, as most educators already know, is some attempt of some interventions, and perhaps we could review that RTI data, or if the school is using an MTSS system, some type of observation of the learning environments and review of that data. Again, back to consultation, perhaps we collect that data together, or I consult on how that it could be done. Then with that information, myself or my team member would be able to decide what type of psychological assessment would be necessary to help provide the student with the services or the eligibility that they need. If it's an academic concern, we would probably do some of that cognitive and processing assessments that would give you some idea of the IQ and the strengths and weaknesses of a specific student. Then there's the academic assessments, which are very important because within the school and the grade expectations, how is the student performing? Are they meeting expectations? Are they struggling in a certain area? And that's specific to the academics of what they're already working with, or what's expected of their age or grade. Then there are the behavioral or developmental rating scales or assessments, again, based on age. Are they reaching their developmental milestones? Do they have the correct adaptive skills for their age range? Are they displaying behaviors that are considered, let's say, adaptable for their age? Or are there, perhaps some unique behaviors displaying that we want to start paying attention to? Again, one of the bigger pieces for school psychology is trying to find early at-risk children, so that if, for example, something like autism was to be displayed, we could catch it early and set up the types of interventions and supports that a child would need sooner than later. And then again, with the social emotional, that's also with perhaps some of the older children. I think it's important to be aware for, really any age, but if there are some children who are looking depressed or overly anxious, these are things that perhaps they're not clinical, perhaps they don't need an eligibility, but we can come in with our assessments and highlight and support students who might have been falling through the cracks. Lastly, many of the students would already be in special ed, already have had evaluations, in which case an assessment would not be necessary. But at times, for example, in the cases of developmental delay eligibility, perhaps it's been past due that they need to have a reassessment and that district is backed up. That's another area where myself or a team member could come in and reassess and basically re-suggest the eligibility for the appropriate age and case of the student, as that can sometimes go on way too long. Again, we want to be able to support any students that would have perhaps been 6 months behind or a year behind, and try to get them the support and services or correct eligibility label that is required and needed for them. Intervention, as I've discussed a little bit, would be part of the planning and consultation, as well as just assessing perhaps if there are already IEPs in place, what interventions are being done, and are they being done with fidelity? Are there ways we can tweak it and make it maybe easier for the teacher, or easier for the student, of course? And so they come in the different ranges, just like the assessments. There's the academic ones. So if a student is struggling in a specific area, for example, times tables in mathematics, perhaps just giving them a different template where they do the math in different boxes. These are just basic academic interventions that, perhaps are not available to a teacher or have been forgotten or haven't been tried. It's amazing what can be done. For example, if a student with issues with writing or struggling with writing, just an outline of the hamburger is an academic intervention. And sometimes they're as simple as that, or they're more complicated and they need, some discussion and consult. The behavioral interventions require many times some collaborations with our behavior analysts to talk about what is serving as rewards for the student or consequences, because you want to encourage the types of behavior that are adaptable in the classroom, and you want to, of course, try to help the student understand the behaviors that are not helping them succeed. For the social emotional interventions, I really appreciate the classroom-wide ones, perhaps things like mindfulness for self-awareness, or some tools for emotional regulation, some breath work. These are really helpful sometimes. And even if it's not a specific intervention for an individual student, like I said, there's times where if you are able to read the temperature of the room, the climate of the room, you can see that perhaps a whole class would benefit from one of these social emotional interventions. Then there are, of course, transition interventions, specifically with some of our students that already are in special ed. Perhaps they have a more difficult time transitioning, and so there's ways to do that which would not escalate behaviors, making them the assistant to open the door and get ready for the class to leave, or turning off the lights, different ways to just make all of these things that a student or a class or a group is struggling with smoother and easier, and support those that need help. So review and planning is essentially all of these things put together. Basically the consult would be the backbone of the review and planning. It would have this type of structure where, again, if there has not been any data collected, we would discuss how to collect it and review it once it's collected. We would go into the classroom, we would discuss the needs of either the student or the group who's struggling academically or displaying any challenges with their behavior. Then we would implement or discuss a development of an action plan, whether it's for behavior or for an academic piece, like we've talked about with introducing new interventions. And very important is, after implementing these new ideas and reviewing with the teacher or the team or the paraprofessional, to check in with and follow up with some progress monitoring. That's, again, an important piece, because once we've established how to collect data, it shouldn't be an additional burden for the professional or the teacher. It should just be a way to see if what we've talked about is having a positive effect, or if we need to try something new and go back to the drawing board. And the same, of course, goes with transition planning. It's pretty quick to see if those interventions are working or not. Let's see. As far as for the school-wide or teachers or just specific administrators, there is also some education and training that the school psychologist can provide to the school. Much of it is similar to what we can do in the individual and classroom level, but we want to talk about it in a broader sense. So, for example, workshops to raise awareness about some of the issues that are affecting the children, for example, cyberbullying, or social media. Perhaps there's been a death or a suicide and they want to talk about grief counseling. This type of education and training and these workshops are something that we can begin to provide. There's also the use of telehealth and technology to overcome some of the barriers that have been an issue for some of these districts before. For example, some of the assessments can be done on Zoom. Some of the consult and, somewhat, I wouldn't say counseling, but the discussions within the consultations that require different sessions can be done virtually on Zoom for everyone's convenience. Webinars such as today can also be done and delivered via the computer and Zoom. So these are just ways to make all of our services more accessible to the school, the district, and the student. Of course, professional development opportunities as well. There's trauma-informed practices. There's ways to support specific student needs in your classroom, and ways to empower the teacher as well, and how they can make their day a little easier and also feel heard and supported, because that then contributes to just a more peaceful and collaborative school and classroom altogether. So I do want to discuss some of the limitations of what KUMDC's team can do for psych services. Unfortunately, we will not be participating in the IEP meetings. So although we can brainstorm and discuss different interventions with the teacher or ESC director, we will not be in the meetings to discuss the findings unless it is specifically requested and approved. But for the most part, it is not customary that we would be present at those meetings. And along with direct interventions, as we've discussed, there's a lot we can do virtually, but we are serving 10 districts at the moment, and it just would not be feasible to even think to offer direct interventions. So we are providing the support and resources so that the people already in school, the teachers, the paraprofessionals, and other members of the team can help implement the interventions we've decided are effective. There are no medical diagnoses that a member of the team can provide. We are not medical doctors or clinical psychologists, so all the findings and reports that we create for the team are used within an educational context. Similar to that, we are also not licensed counselors, and so there is no diagnosis or ongoing treatment of mental health disorders through therapy based interventions. All the interventions and all of the things within the realm of our work here is within an educational context, and they are specific to addressing academic, social, and emotional needs within that school environment. So the referral process is relatively simple and probably the most important part of this discussion. You ideally would be communicating with your school administration's ESC coordinator to see if some of the RTI needs to be set in place or MTSS, and then perhaps discuss some of the concerns where they will decide, okay, our current school psychologist or our team can't get to this right now. We are able to reach out to Kaiser's team to fill in the gap. And if that's the way that the school is going to reach out to me, that's perfect. And the referral will be discussed at that point. However, feel free to reach out directly. At the moment, I am completely available to answer any concerns and discuss what the team and myself can do for your school and district and the specific needs that you may have. These are some of the references for the information you have for school psychologists. I appreciate your time today. If there are any questions, please feel free to email them to me.